So to start off, can we talk about hypothyroidism? Um, what is the basic um, definition of hypothyroidism? How does it affect our health?
Laura, I'll let you start on that if you want.
He always likes to put me first. I don't know why.
That's right.
Just a general answer to that would be basically your thyroid is what controls your metabolism. So when you have an underactive thyroid or it's not putting out enough thyroid hormone, then your metabolism is slowed down. There are a lot of things that can cause that to happen. Other metabolic reasons that you can have an underactive thyroid, but basically, your pituitary puts out a thyroid stimulating hormone that tells your thyroid what to do, and then it throws out a T4 or thyroid hormone, and then it cleaves off a portion of that to become T3, which is active. It's a very complicated organ. Most people look at just maybe one or two of the elements of thyroid, and that's why a lot of people are walking around with underactive thyroid because they're not really being evaluated thoroughly.
Yeah, and thyroid does a lot more actually than just metabolism too. I mean, it affects really every aspect of our life. So, absolutely, the biggest probably function is energy metabolism, but then it also affects sleep. It affects
Yes.
how we respond to stressors, i.e., high, heat, cold, those types of things. So, thyroid's fundamentally important, really, in everything that we do throughout the day. Metabolism is the big thing. I mean, consistently across the board, if you've got an underactive thyroid, you can have patients that have some weight issues that are very difficult to get over. Hard to lose weight, hard to gain weight. Overactive thyroid, you have patients then that can have problems actually gaining weight, putting on muscle mass. So, the thyroid, hypothyroid, underactive thyroid can mean a lot of different things because the thyroid can be acting, in a dysfunctional manner that throws everything out of whack. And the part of that is the difficult part, as Lori talked about, is that there's so many different factors that affect the thyroid. Other hormones, how they interact within the body. You have multiple glands that are, processing information as it flows through our blood, telling the thyroid what to do or what not to do. And so, the thyroid is at the mercy of some of those information systems that are giving it information and telling it what to do. So, a lot of times we'll have underactive thyroid or hypothyroidism, but it's not necessarily directly a result of the thyroid gland itself.
Correct.
It could be something else downstream. It could be
Yes.
it could be an immune system issue. Could be a issue with nutrient deficiencies. Could be a hormone imbalance that's causing the thyroid to be dysfunctional. So, a lot of times the solution isn't just putting somebody on thyroid medication for hypothyroidism. And it's because there's just so many factors that contribute to why the thyroid isn't doing what it's supposed to do. But sometimes it's not the fact that the thyroid's not doing it. It's other parts of the body aren't doing what they're supposed to be doing to process the thyroid hormone and make it function correctly.
We have those people that have come in and they look like they're hypothyroid. Then once we replace their vitamin D, get their hormones replaced, and then you run that test again, and they're in perfect sync with that. The numbers are good. So you just, like you said, you just can't stick a sticker on it and say, "Oh, that's hypothyroid." You have to really evaluate what could be causing it to be low.
Yeah,
How's
for
it
sure.
typically diagnosed?
How's it typically diagnosed?
Yeah,
So, I
how do you
mean, a
find
lot of
out?
times, I mean, you have that classic symptom picture of someone who walks in, right? Hair thinning, skin's dry. Sometimes they have some anxiety issues, right? Other times they can have a little bit of almost like lack of like energy, sluggishness, those types of things. But, thyroid issue, when you look at their daily life, is a lot of times it's a failure to thrive. They just don't have energy to do a lot of things. They don't feel real good because, again, it affects so many multiple organ systems. It affects the musculoskeletal system, it affects the skin system, the integumentary system, affects so many different things. And so, how to diagnose it, a lot of times we do, your typical doctor as a medical professional will go in, they'll look at maybe one test, TSH, thyroid stimulating hormone, which is actually from the pituitary, doesn't really have any impact or really, delegation / direct view upon what the thyroid itself is doing. Or, if you're lucky, a lot of times they might look at TSH and like a total T4, which is your main
T4,
thyroid
correct.
hormone your body produces, but not the actual functional hormone. So we approach it quite differently in the fact that we do, our panel's 7 or 8 tests, and the fact that we actually look at the thyroid itself in its function, and then we look at the different thyroid hormones that the thyroid actually kicks out: T4, total, T3, total, T4, and T3 free, which is the actual functional part. And so the part of that, the problem is though, some of those conversions occur in the liver. So you could have a functional thyroid that's doing great, but a dysfunctional liver, so then you're not converting your T4 into T3. And so the big thing is doing the proper blood work. That's going to be the key component for diagnosing thyroid issues is the right blood work, looking at both the thyroid issue itself, plus then other issues as far as the liver and those types of things.
That being said, a lot of patients do, like they say, when they run that TSH. I'm an example of that. My TSH was 0.9, which is awesome. It looks like that. Oh, my thyroid is working fine because it's a good number between 1 and 2, basically. But then when I ran the other tests, I was not functioning correctly. So, you can always miss that. A person's still complaining. I'm not thriving. I'm exhausted. I don't sleep well at night. I've got dry skin. And other things too is the outer eyebrows will get a little bit thinned out, as Darrin may have already pointed out. But, these are the things, and they're saying, well, your thyroid is normal, your labs are normal, and they're not looking any deeper. And that's a frustration for that patient because they're like, well, what am I supposed to do? I mean, everything's supposed to be normal. Why do I feel this way? So it takes a little more digging deeper to look at those levels and really diagnose those patients.
Yeah, unfortunately, it's one of those things that's severely underdiagnosed. The average thyroid patient that has significant thyroid symptomatology goes 10 years without a proper diagnosis. That's
Absolutely.
terrible. We have to do better. The medical community's got to do better. These people are suffering. That's 10 years of their life that they didn't feel good, right? I mean, didn't feel good in how their energy levels didn't feel good, like muscle soreness, muscle pain, those types of things. I mean, not being able to sleep well, consistently tired because of lack of poor sleep. So these are patients that are suffering, and unfortunately, they're not getting diagnosed in a timely manner whatsoever because the right testing is not being done.
Is there a certain test that someone who thinks they might have it should request, or is it typically showing up in a blood panel at their annual
If they're going to the
physical?
regular doctor, they're not going to run but 1 or 2 tests. And that comes from Western medicine. I mean, I was trained that way. I was told never look at anything other than TSH and T4. Possibly that's all you need to look at. It's just going to muddy the water. It's confusing. You shouldn't treat those other levels because that can cause a stroke or a heart attack. That's absolutely not true. I mean, that is not true. We monitor these patients closely on their levels. If I put them on an active form of thyroid like T3, I mean, I'm monitoring their labs every 2 weeks to make sure their levels are not getting too high. We don't want them to get too high. We want them to be in a functionally normal range that makes them feel better. So it's like, I mean, my mom, she can't get her doctor to order this test. I'll order them on her. I tell her she needs T3. Her doctor won't give it to her. They just will not. They're just not trained that way. It's been year after year. My grandfather was a physician, not mine. I'm saying your grandfather was one, your dad was one, you're all treating it the same way. And it's been how many years it's gone by. And you're not stepping up to the plate and taking care of the patients further than just those 2 numbers.
Yeah, if you go to your regular doctor and you suspect you've got thyroid, you're not going to get the right testing done.
No.
It's just not going to happen. Like I said, there's 6 or 7 tests that have to be done as a basis to start looking at thyroid in an in-depth picture because you've got to look at both the T4 and T3 subset of hormones for the thyroid. You've got to look to see how that hormone's being taken into the cell. You've got to look and see how that's actually being made because there's a lot of problems where, thyroid has a very specific receptor site on the cell, right? And occasionally, for whatever reason, we don't know why, your body will make the thyroid hormone backwards. So it's like trying to put a right-handed glove on a left hand, right? It looks like it should fit perfectly, but it doesn't. Mm-hmm. And so, we'll run into issues with that with patients as well, as there's an actual defect in that conversion. And so, that's the thing. If doctors aren't trained to know what to look for, they're not going to look for it. They're not trained to actually know what blood work needs to be done. They're not going to look for it. They're not going to do it. And a lot of times, for whatever reason, they get offended when you ask them specifically, I want these tests. And we've ran into that a lot. Well, who told you need these tests and why? And they're unfortunately just not educated enough about the thyroid to actually say they even treat it, to look at it, to diagnose it. And we just run into that all the time. We have these patients coming in for years. They've been on the same medication, never adjusted. Other issues aren't looking at. And they say, from the time I started medication until now, I feel the same. I don't even understand why I'm taking it. And we run into that all the time because they're not being looked at thoroughly enough to actually be treated effectively.
And to be honest with you, BG, a lot of times they'll have lack of sleep or they'll have some anxiety or failure to thrive. And well, let's treat that symptom. Let's give you a sleeping pill for that. Or, they want to treat the symptom the patient's having, but they're not looking at what's causing the symptom. And that sometimes as functional medicine providers, that's what we do. We want to see what's causing that if we can find out
Right.
why. And if we can't find a reason, then you can get a sleeping pill. But there may be something underlying that's not letting you sleep, or those types of things. That's what the difference is in how we practice.
So once they're diagnosed, what's the typical treatment that a regular physician might do versus what more aggressive you guys might recommend for a turnaround?
Sure. Typically, what you're going to see is they're just going to throw them on Synthroid. I mean, across the board, 95 greater percent of chances that's what's going to be. They're going to say, here's Synthroid, start taking it. Then more than likely, they're not even going to follow up on the dosage to make sure it's correctly. I mean, to do thyroid correctly, you prescribe a set amount of medication, do blood work again in 2 weeks, check levels, right? Depending on those levels, you adjust the medication dosage, do blood work again in 2 weeks so the person is saying, man, I feel great. The thyroid levels are where they're supposed to be, and those two match up, right? So you got to have symptoms matching up with the diagnostic of the metrics, right? So typically that's what you're going to see in a typical medical practice. Unfortunately, you just don't see that, right? I mean, that's what we want to see, but they're not. They're just going to they're going to prescribe Synthroid, say, here's your medication. That's about it, usually. I mean, we see that over and over again. Unfortunately, that follow-up testing isn't occurring. And then the other part of that Synthroid is just T4. So then they're not checking the T3 levels of the individual patient and see how T4 is being converted into T3, which is the functional part of thyroid hormone, right? You can have all the T4 in the world, but unless you've got the right amount of T3, it's shaped correctly, it's getting into the cell, it's not going to do you any good to be on medication. And so that's the vast majority of the part that we see with physicians and current patients, that part's being left out, right? That T3 is not being monitored. And if it is being monitored, then they're not looking, okay, if there's issues there, why are there issues? Is it at the liver? Is it nutritional deficiency? Is it another hormone balance affecting that? So that's what you're going to see. Typical allopathic, just medical doctors, here's Synthroid, here you go. And if you try to discuss that with them, a lot of times, again, they get offended. They know what they know. Unfortunately, wasn't a lot when it comes to thyroid medication. And a lot of times they've got a basis, if that, of basically what the drug reps are coming in, educating them with, unless it's something that they're very interested in. A lot of them won't even use some of the newer medications out because they've been basically miseducated, maleducated about the medication, or just don't know much about the medication itself because again they just know what they know and they don't really look outside the box at all. And I know
And
Lori
you have
coming
to
from
realize
the medical
yeah,
establishment, she's dealt with that. Yeah.
the majority of the people that and I worked in primary care prior to going, when I first came out for a year with cardiology is my background, as we know. But you're taught you put to the TSH, look at the T4 possibly, put them on Synthroid, and we typically were told don't check the levels for anywhere from like 3 months. Now I understand in the concept why we don't do it as quickly on T4 or Synthroid because it does have to throw out more T4. And it does have to convert. The conversion is a little longer than me just giving you the active form of that. But when you're like you said, if you're not looking at what those levels are at T3 at all, when you put them on the Synthroid, well, you're supposedly trying to make it more, convert more, but how do you know what it's doing when you don't check that level? So it's like you're just taught that way. And a lot of primary care physicians, again, you're coming in with a blood pressure problem, your thyroid's messed up, your hormones are jacked up, you've got 5 or 6 things you're coming in for, and they've got a 15-minute window to try to address it, and they're not going to get to that. And they get as much as they can at that moment, they go on. And it's a sad concept, that's the way it is. But even an endocrinologist, there's not many around. And I have a friend that goes to an endocrinologist, and her TSH is 4, and it should be between 1 and 2. That right there tells you that there's something going on with the thyroid. Well, it's fine. We won't look at it till it's 5. She's walking around and metabolically this thyroid's not working correctly. And that's an endocrinologist telling her that it's okay. So I just think sometimes they just get in that place where they're only taking care of one specific area in their field. And then they don't really look outside the box. And in primary care, for the love of God, they've got so much in their plate, in their face all day long, that they just need a specialist or someone who's going to look deeper, like Darrin and I.
Are there lifestyle changes that you can make to help an underactive thyroid and make improvements there that are more, home remedy, so to speak?
Absolutely. So first of all, healthy diet's huge, right? So we know for sure, there's a lot of studies done on this now that, environmental factors affect the thyroid function, toxicities, those types of things. We know specific types of foods, phytoestrogens, which have been accelerated in their affect because of genetically modifying foods, right? So we know phytoestrogens. We know a lot of these plastics, microplastics, have a big effect on the thyroid, right? We also know that inactivity, obesity, all of these, because they affect so many of the hormone levels, that affects the thyroid as well. Of course, then just poor nutrition. Poor nutrition is huge in regards to negative affect on the thyroid. So, that's the one thing we always encourage with patients. We go over a significant amount of diet. We spend a lot of time with dietary issues with these patients. Getting their diet cleaned up, eating more of a whole food-based diet, getting rid of the boxed food, eating things more that are going to support their hormonal balancing, good fats, those types of things, getting exercise. That's a lot of it. A lot of times we see patients, we run these nutritional deficiency tests, the trace minerals are all over the place. I mean, low, everything, right? Because they're just not eating good. And so, that has a major effect on the thyroid as well. So when you start eating a much more clean diet, natural food diet, higher protein, good clean fat diet makes a massive difference. It can make a massive difference in thyroid function, as well as, supplementation. But you've got to have somebody that's actually looking at that to say, okay, listen, is there a deficiency? What's the deficiency, and could this be causing? But, avoiding anything that we see, Lori, I see it all the time, patients coming in now that, everything's got an inflammatory response. Either inflammatory markers are through the roof. So the more that we reduce inflammation in the body, the better the thyroid acts, the better the thyroid functions, right? So eliminating a lot of those things out of the diet that cause those inflammatory responses are huge. Lori, you want to go over maybe some of that as well, too, in regards to what we eliminate and what we work with our patients?
He pretty much answered that.
So, yeah, I mean, really specifically, I mean, seed oils are huge. So, because the chemical processing of seed oils, so what we're talking about when we say seed oils is going to be your canola oil, your vegetable oil, safflower oil, sunflower oil, palm kernel oil, peanut oil. These are all highly processed. Basically, they have to go through 4 or 5 different types of industrial solvents, super high heat. So the oil is nothing like it was when it came out of the seed and how it was originally processed. So a lot of these oils have a big inflammatory impact upon our systems. And of course, some people are way more sensitive to it than others, right? So, that's one thing that we look at. Then sugar is another highly inflammatory agent. A lot of our patients come in and have terrible diets, right? Their triglycerides are terrible. Their blood sugar is out of control. They have all these other numerous issues going on as well. And so we've got to address that because, again, sugar is a huge component as far as driving inflammation within the body that can interact and cause problems with the thyroid. Of course, then, like I said, and I've already mentioned soy, phytoestrogens. So those are a lot of the things we go through when we look at with patients is diet modification. And then the other thing is, not just with the diet, but then the types of foods and the sources of those foods that they're eating can make a massive impact on overall level of health, but then also specifically with the thyroid function itself.
I know I cut those nightshades out, correct? With
Yes,
like I
nightshades are
used to eat
huge.
I used to eat green peppers almost every day. I mean, there's the certain foods that are nightshades I ate all the time. I hardly ever have those anymore. I've cut those all out of my diet. I hardly have dairy. I rarely have dairy. Majority of the time, I don't eat it at all. Sugar's the weakness for me. Occasionally, I have something sweet, but I'm just when you bring those things out of the diet, it's amazing as you eliminate those how much you realize that you feel better. You have no idea how bad you feel until you remove those items from your diet and leave them out. And then when you try to slowly introduce those back into it, then you say, "Oh no, I don't feel well when I eat that." So it's what you have to do is the patient, the client has to actually step up and say, "Okay, I'm ready to take on this challenge. I'm ready to change things around so I can make myself feel better." And it's a lot. It takes a lot. It's a life change. I mean, it's a big change. And we stick with them. We try to, we send them texts. Darrin sends them diets. We try to do all we can to keep them on the path. And they'll tell us, I didn't want to do this at first, but oh my gosh, I feel so much better after 2 weeks. It's ridiculous, just changing their food. And people do not realize that in the United States, inflammation. You can walk through the grocery store and you can see someone. You go, oh my gosh, by looking at them, they have inflammatory disease. It's crazy. And you look at their cart and you know why.
Yeah, I've got patients in other parts of the world that I'm working with. A lot of things I'll suggest here as a food, they can't even get there, or if they can get it there, it's labeled that it has toxicities in it, and it's come from the United States. Mm-hmm. So it's crazy when you look at different countries and what the allowable limits of certain things are. The United States is, unfortunately, it's an open book. I mean, it's not an open book, but I mean, everything's allowed here. I mean, it's crazy what we're allowed to eat in comparison to what all the other countries are allowed to eat and ingest. And, and theirs have warning labels on them, contains A, B, C, D, could be a problem, or, those types of things. And we don't get that here. It's just, it's so based on money and profit, the food system here, how much you can produce, how much can be consumed, those types of things, how fast we can get it out, how long the shelf life is, that we've lost that inherent ability to just eat good food on a regular basis that's fresh, that's not laden with chemicals and those types of things. So, we always say, listen, eat on the outside of the store. That's where you're going to do the best.
Right.
That's where you're going to find the healthiest stuff. And then, and as you can tell from what we're talking about, everything is so individualized with thyroid. What some patients have susceptibilities to, others don't. What some patients have problems. And that's why some of the doctors most doctors don't want to address it, because you've got to look at diet. You've got to look at chemical exposure. You've got to look at inherent issues within the body itself that, that are causing these problems with thyroid. But, that's the big issue with it. It's so individualized that you have to look at lifestyle, you have to look at diet, you have to look at some of these factors that can be a major contributing role in thyroid dysfunction. A lot of doctors just don't want to take the time to do it.
I think it's so sad. We have an epidemic of fatigue in our country, and it's
Yes.
caused by numerous things, of course, but and not even knowing or being able to be diagnosed for what the problem is. And it's often so treatable, and it's so, it's something that you can turn around if you know what's going. So thanks to you guys for doing what you're doing, and really, making a connection with people where they are, and truly spending the time and the effort to dig in and find out what's going on to get them the treatment and the help that they need. Really appreciate that.
Yeah, we love what we do, so that makes it the easy part of it. We like to figure out the puzzles, right? That's the thing. We like to be able to put the time in and say, okay, listen, this is the causative factor. This is what's going on. So it's always a challenge. Every day we love what we do in regards to that, because we get to see such an impact on people's lives, and sometimes it's a very simple thing to fix. And they think you're something wonderful, and really you didn't do that much, but it was just, change a few things here and there in regards to lifestyle sometimes. But, we really appreciate it. It's something that definitely needs to be addressed way more in depth by a lot more providers, but unfortunately it's just not going to occur, I don't think.
I'll tell you, it has been noticed with some of our clients that are going back to their primary care physicians, because we have one who's actually referred her clients to us, and she's a primary care provider. And one of the girls at the gym where I go, and she actually told me this morning her physician was so excited when she told her, after she gave her lab orders, that she was going to talk to me because she wanted to add things to her labs. And she told her what we did, and she's like, "Oh my gosh, are they taking patients? I want to send them patients." So, we, like you said, we've worked for a little over a year. Word of mouth, we just take care of clients. We're just starting to really get out there, and to have family physicians actually want to refer their patients to us is a real compliment to me, because they're knowing I don't have time for that. Let me send those people out. And that's the message I want to get out. We don't want to take your patient away from you. We want to help you take care of the patient correctly and make the patient better. We're here for that reason. So that's the message I want to be sent out to these primary care doctors. If you don't have time, if you want to look more in depth with that thyroid, send it my way. Send it our way. Let us look at that and fix that patient for you. And they're going to continue to come to you. We just want to get that patient more well-rounded and well. So they have a lot of life left to live. So let's give that to them.
Yeah, we're not primary care. We don't put that out there. That's not what we do, right? We're more in depth than that in regards to, we're looking at problems that people are having significant issues being able to function, right? So, that's what we tell her. Somebody calls to say, I think I've got strep throat, call your family doctor, right? Correct. I think I've got, some of these other issues going on, call your family doctor, right? That's not what we do. We look at hormonal imbalancing and how that plays a role in the everyday lives of people, whether that be thyroid, whether that be testosterone, estrogen, progesterone, numerous other factors, right? That's what we do. That's our wheelhouse. So we're sending these patients back to their PCPs to say, listen, address that with them, right? We'll do what we're really good at. We'll deal with that. But these other issues, address with your PCP. They've been taking care of you for so long with this. You're doing great. Address that with them, right? And so we stress all of our patients. We're not primary care. We don't do primary care. It's not what we have an interest in whatsoever. And so, yeah, we are working with a lot of the PCPs around. And as we see more patients and we're getting the results that we're getting, more and more providers are starting to refer to us on a regular basis for hormonal balancing, whether it be thyroid or other types of hormones, it doesn't matter. And like you said, fatigue, it's everywhere. It is a crisis, right? And so, a lot of these patients just aren't getting addressed because they just really don't know how to address them. It's not that they don't want to, they just don't have the knowledge base to do it. And like Lori said already, the time. I mean, I've got friends that work in a PCP office for the major university, and they have 8 minutes per patient. That's all they're allotted, period. I mean, they have to hit a set fundamental number of patients every day, right? And they have to do that. And they have to see those patients till they see them. So if they don't get through them, then they're there till 8 o'clock at night, right? And so they just don't have the time to thoroughly investigate and look at some of the issues that we're taking the time to do. And unfortunately, like I said, fatigue is one of those, like Lori said, it's huge. And like you said, I mean, it's massive. Every patient coming in's got issues. But we're an on-the-go society. We don't stress, taking care of yourself. We don't stress relaxation. We don't stress any of these things. Just go, go, go. Do everything that you can. And that's we're starting to see a lot of these issues now because it really comes down to a fundamental issue: nutrition, diet, healthy lifestyle. Huge.
Mm-hmm. Yeah. Well, let's switch gears for a minute and talk about testosterone, because that's going to have a lot of the same, I'm sure, home remedy lifestyle changes that, can help folks as well. I know, but then this is also an imbalance. So let's talk about that. What is low testosterone? What's that really mean? Is it male only? Is it male, female? Does it affect, all of us? And how does it affect the health of the patient?
Right. So, low testosterone is not a male-specific problem. And if anything, we probably see as many females as we do males with issues of low testosterone, period. It's a crisis. It's an epidemic. The National Institute of Health has put articles out about it, the testosterone crisis. It's going to become a population issue, they're saying, by the year 2050, because it's so low that, ovulation cycles are getting thrown off, sperm counts are being thrown off. Like, what we're looking at both from the male and female perspective is going to become a crisis because we're seeing so many people with issues with it. The symptoms overlap a lot. So you're going to be looking at, fatigue. You're going to be looking at failure to thrive, weakness, inability to sleep well, get to a deep sleep, right? Recuperate from gym time, those types of things, right? Mm-hmm. Unfortunately, when you get into testosterone, estrogen, progesterone, lifestyle can make somewhat of a difference. But if it's really low, it's just low. You're going to have to do something exogenously to treat it, right? Now, that being said, if you're a 19-year-old, and we've seen these already in our office, we've seen these patients coming in 19 to low 20s, testosterone unbelievably low for their age. It's pathologic, right? Now, that age group we can do a lot with because a lot of times that's an obesity problem, a lack of exercise problem, terrible diet issue, tons of stress, cortisol's through the roof, those types of things. So we can address that. But, the problem is the male or female coming in, let's say that's 42 to 50 years old, right? Relatively clean diet, right? Exercises a little bit, and their levels are really low. There's not much you can do. Really look at outside sources to bring those levels back up to a functional level. And we've got to intervene sometimes with either supplements, therapeutic uses, whatever. But it's a common problem for both men and women, and it's getting worse all the time. We're seeing patients. 10 years ago, I never saw a patient that was in their 20s with low testosterone. Just didn't happen, right? Now it's common. We see it all the time. And no one's really ever looked at women to see what their testosterone levels are and how it's affecting their life. And women, unfortunately, probably get the worst end of the rap on it when their testosterone is low because they really suffer a lot. And so that's the big thing. So, women are probably just as much of a patient population for low testosterone that we're seeing now as anybody.
Absolutely. And again, with that being said, the same thing I mentioned earlier about thyroid, they go into the doctor's office and they're complaining about these symptoms and they just say, well, let's fix that anxiety. Let's put you on a medication to help your anxiety. Or let's, they help you sleep, all these things. And when they're not really looking at the underlying problem, because again, that time window they have, and I don't want to blame physicians because it's just the way it's always been. This is something that people don't really delve into. My primary physician did check my testosterone level after I had a hysterectomy, but and I was on an oral medication that wasn't doing much for me. But she did test it. Some of them do, but then they don't really go any further with what it is other than just giving them the medication. There's so many other things, like Darrin mentioned, the cortisol level. The cortisol, if it's elevated, if you have a high cortisol level, it's going to compete for that site that the hormone needs to go to get, to be into your body or whatever. I'm just making it simple, but without going into any scientific terms. But, you got to look at that. You got to, are they stressed? Are they overly stressed? Have they pushed it to the limit and they have adrenal insufficiency right now because their adrenal fatigue is going on? These supplements can help put that cortisol back in the right level. There's supplements that we use to boost those testosterone levels. And those we try to do it naturally most of the time with the people that we can get it to work on. If it doesn't work, then we go with it. Most of the women, I say all of our women, are on bioidentical hormone replacement therapy. That's the way I go
Yes.
with it if I'm going to do it. It's usually a cream or a troche that they can put between the cheek and gum and let it dissolve. It bypasses it. It doesn't give you a second pass through the liver to be working or to be metabolized. It's a safe way of giving it, and it's bioidentical, as I mentioned. Even some of our men are on bioidentical hormone replacement with cream, and they're doing well. It's just the person, it's whatever the client feels more comfortable with. If they don't want to give themselves an injection as a male, then we'll
Hmm.
go that route. If it doesn't work, then we're like, okay, it's not working for you. Let's move to a different therapy. We just don't put that, again, it's not just you don't put you're in this box, this is what you get. Oh, you check this box, you're here. And you have to really look in depth at symptoms relative to what hormone level is low. There's a check system that I'm going to start incorporating that actually progesterone. If you answer 3 out of 5 of these questions yes, then you have a problem here, and we need to investigate it further. It may not look like there is one, but there's something going on with that hormone because you're having those symptoms. So it's a little more complicated in my opinion for a woman because we have to look at so many other areas. Men, it can be difficult sometimes. They don't. Do well with a specific testosterone. The cream doesn't work. We have to put them on an injection. But it's more of a rarity than, don't you agree, Darrin? That's
Yeah,
more
men
rare
have
than
about
men that.
maybe 3 or 4 hormones that can interplay with testosterone causing a problem. Women have about 10. So I mean, it's more than double. I mean, it's
We're always
yeah, and
complicated.
yeah, they're very complicated. When they're cycling, they're literally like 3 different critters throughout the month. So I mean, that's the big thing. Women complicate things all over the place. It's tough when it comes to managing hormones. Guys is are really pretty easy, right? Like I said, there's 3 or 4 basic hormones we've got to look at that could be causing interference with hormone, like any type of hormone utilization. Women, it just gets a lot more in depth, and a lot of docs just don't have the time to look at it, nor the knowledge base really to see what's going on. And so that's kind of where we come into play, and our knowledge base and our expertise comes into play with managing these patients better than what they're getting outside in their traditional PCP medical practice, medical doctor office.
I know that I remember there being a stigma around low testosterone, especially particularly for men. Where did that come from? Is that something you'd like to address? I mean, can men have a difficulty with their health anyway, getting treatment, and I think we're always more sensitive or more resistant to being vulnerable and
Hmm.
reaching out for that. But is would you like to speak to that? And men may be feeling this, but they also may have this stigma of maybe there's something wrong with me and I'm not what I should be, and it's preventing them from seeking the treatment that they really should get,
It's
and it's not
tough.
that big of a deal.
Yeah, I work with a men's mentoring group, and this is a group that's all men. And even having discussions, sometimes they'll be like, I was kind of embarrassed to bring it up, right? Or I'm
Right.
kind of embarrassed because they feel it's like a weakness, right? And
Right.
so that we see that it's kind of like a stigma that they don't want to say I think I have a testosterone problem, or really men don't really want to say they have a health problem at all,
No.
right?
Right.
They don't want to address it. I think it's a weakness issue. It's what if it impacts other things that I try to do? Those types of things. So unfortunately, I see it a good bit. Like I said, within the men's group that I'm working with, guys that they feel very safe still have a hard time going, man, I'm kind of embarrassed to bring this up, but I have issues with libido, or I have issues with my energy. Like no matter what I do, I just feel tired. They're afraid that somebody's going, well, you're just a sissy, right? Suck it
Right.
up, be a man, or hey, you're just not getting enough sleep. Go to bed earlier, do whatever, right? And that's just not the way it is. And so guys just don't want to deal with it a lot of times. So they don't address it and they're suffering, right? Women are a lot better of going, hey, I've got a health issue. I need to get it checked out, period, right? And so there is a big issue there with men being more open about their health care. And so, when you've got, things that just don't work, guys don't want to go to a doctor and say, hey, doc, my penis isn't working the way it's supposed to, right? And so, but it's just this thing we're taught, I guess, as dudes to say, listen, we can't talk about those things. But unfortunately, we absolutely can, and we need to, right? They need to
I'm
say, I've
gonna.
got
Yeah.
erectile problems. When I try to have intimacy with my wife, there's problems there. And that can create a marital discord. I mean, it's huge with that, right? Because, you've got one partner thinking, hey, I don't think I'm attractive. There's all kinds of things that
Correct.
can run through your head when there's intimacy issues involved. And so you guys will avoid the issue. I see that all the time in the guys I work with. They literally avoid intimacy issues with their wife because they're too afraid of what's going to happen and how their wife's going to receive that, right? Then they're not going to turn around and discuss it either and bring it up with their doctor. So guys get a really bad rap in the fact it's very difficult for them to bring some of these because it's just seen as a weakness, right? Or you're doing something wrong, you're not doing what you should be doing, or you're not looking things the right way, those types. And it has nothing to do with that. Like I said, we've got 19-year-olds coming in with low testosterone. 19-year-olds, right? There's nothing that kid did. I mean, they're still a kid at that point. They're not even hormonally mature, and yet their levels are terrible. There's nothing that they did to get to where they are, right? That's just the way they are. Is it chemical exposure? Is it lack of hormone? Is it just underactive gonads, right? Maybe their systems just aren't doing it. But unfortunately, these are the guys that don't want to come in because, man, I'm 19, I shouldn't be they just don't want to discuss it, right? And so it's kind of taboo or whatever. So men do have a rougher time in dealing with a lot of this because just the way society throws it on, and then, there's such a misnomer about steroids, right? And that they're terrible for you, that they make you to be a jerk, right? And people on steroids are not nice people and all. And that's completely misinformation. There's no truth to that whatsoever. Probably some of the nicest people you'd ever know are on steroids, right? And they're taking them prescribed by their physician, getting monitored the way it's supposed to be, those types of things. So there's that misnomer too that guys are like, man, I don't want to be on steroids because there's such a negative connotation with it, and there just doesn't need to be at all.
With me, probably 20 years ago when I was a nurse with the cardiology group, I took on a task to help one of my sales reps that had Cialis. And of course, it was cardiology patients. So, we said if they're having erectile dysfunction issues, which sometimes that could be a first sign of cardiovascular disease. Atherosclerosis, because those vessels are being blocked off. So that's why I tell every client that comes in my office, now, your testosterone is low, we're going to fix that. If this does not help, and, we may need to look a little deeper into this, which we do anyway. But for example, there was a questionnaire. I had 10 questions I asked every gentleman that came in that office. And I will not forget, numerous times a day, they would come to me as they were leaving and say, I want to thank you because a doctor never asks me these questions. And they're not going to volunteer that information. They need to be asked that by their provider because it is embarrassing. No one wants to say, listen, I can't, my wife, I can't satisfy my wife. I lose my erection in the middle of intercourse. And I don't even want to go there. And when they come into me, they're initially embarrassed a little, but then they realize real quick that I'm just one of the guys. I'm going to talk about it with you because I've always been that way. Back then as a nurse, 20 years ago in a cardiology office, and I'm actually probably more brazen about how I talk to people now. But it's like, it's so crucial, and you're right with the misnomer and how they feel about steroids, because one of our clients comes to me in the morning at the gym when I open to get his injection instead of driving to Cross Lanes in the middle of the day and down to Taze Valley. And I'm like, just come, I'm working, And when he comes in, he's tried to be so secretive about me giving him this injection because he's worried about one of those guys thinking he's on steroids. I'm like, what you have to understand is, that's not, you should be ashamed of that. You don't feel well without this. We're not shooting you over the edge. We're keeping you in a normal level. We're not shooting you up to over 1,500 where you're trying to be the crazy guy in the gym. It's just because your health requires this, but that Darrin's right. They have this impression that if you shoot up on steroids, you're crazy. You're going to have a roid rush in the middle of the gym. And half these people don't even go to the gym that we treat. They just don't feel well. And,
Yeah.
This is good. I think this was very comprehensive. I'd like to ask one more question if we got time, just, really briefly, because of what we've been talking about, underactive thyroid and testosterone and not being identified by our primary physician a lot of times, or they're just not set up to be looking for these things. How important is it today for each individual to take personal responsibility for their health care and figure out what's going on, and how do they do that?
Well, in general, it's absolutely vital for them to take charge of their healthcare, period, right? Because doctors in general are just too busy to address all of it now, to do it thoroughly, right? So, in general, across the board, everybody needs to take a vital step is just being in charge of your own health. Get educated, read, look at your diet, look at all of these things individually, right? And ask questions, right? Ask a lot of questions. Just because a doctor says something doesn't mean you shouldn't second guess it or ask a question about that. It'd be explained to you, if I need to be on this medication, why? I need to do this. Why? What is the point of, of me, going out and doing these tests? What are we trying to learn? Those types of things. And so it's vitally important across the board, both men, women, children, everything, to get educated, to be your own health advocate and take charge of your own health, because doctors are just too busy. There's just too much out there for them to cover in the timeline that they're allotted, with whoever they're working for and seeing these patients now, unfortunately. So it's absolutely vital. You have to do it. You've got to get educated. You've got to take charge of your own health. You've got to start managing your own diet. You've got to start looking at how you're eating, what you're eating, when you're eating. And so all of these things are massive components of overall level of health. And then we start getting into stress levels and all these other things. And so if you're not taking charge of that you're on your own, no one else is going to do that for you. And the doctors absolutely can't manage it. I mean, there's just no way that they can do all of that, take care of all that, address all of that, and the little bit of amount of time that they're allowed to do that, unfortunately.
I think that what I ask myself this, I always did that when I do have a change in my life or what I want to do. What is my why? Why do I want to feel better? Do I want to be a better parent? Do I want to be a better spouse? Do I want to be a better grandmother, which I am? Do I want to play with my grandchildren? How long do I want to live? Do I want to be around for my family? Do I want them to take care of me when I'm sick? That's true. You may still get sick. But if all the preventative medicine is just so important, and people, and it's sad because it's generational. Your grandparents ate this way, your parents ate this way, you eat this way, you feed your kids this way. That's from mine. I grew up with a protein, a vegetable, a salad. We may have had bread. I mean, I had a full course meal when I ate dinner. It was never the things that people eat today. So I fixed food that way. But I see so many, coming in a cardiology office, and they've had open heart surgery at the age of 38, and their child has McDonald's, and they all have Mountain Dew that's a liter bottle with them, and they're diabetic, and and it's because the education is not there. If they come from that environment, they don't know any better, and they just live their life just continuing to do that until they meet someone like Darrin or myself that we're just like, you got to change this, because if you don't change it, I had a woman last week leave the office and cry all the way home because I said, I want you to be afraid when you leave here today. You need to be afraid of what your levels are. You need to understand how important. You're young. You need to live the rest of your life. However, I may have made her afraid, but she's already making changes. Darrin went through her diet. We went through all that she ate. But that's what it takes sometimes. It takes that fear factor to make someone realize, oh my God, I am that unhealthy, and I've got to fix it the best I can. But I think it's the question, why? What is my why? What is your why? And then you figure that out, you write it down, and then you know what your goals are to get there. And you have to you'll sacrifice, you'll jump over hurdles to get there.
When you have a provider say, listen, do you like your kids? Do you like your family? Yeah. Do you want to see them in 10 years? Yeah. Well, you're not going to. I mean, flat out, with some of these patients coming in, you're not going to be here if you don't change some of these things in your diet, in your lifestyle, smoking, drinking, the stuff that you're doing, you're not going to be here. Like, diabetic issues are rampant now. I mean, we're seeing more problems with diabetes than ever.
Terrible.
And that's purely a diet. I mean, that's diet and exercise. That has nothing to do with hormonal imbalance. They're just eating terribly, right? They're not taking the time. Everybody wants to say I'm too busy, which is the biggest BS cop-out there ever has been. I'm too busy. You're never too busy. It's just what you prioritize, right? Are you going to prioritize your family? You're going to prioritize the people that you love? Or are you going to prioritize your health? If you make those things priorities and you throw everything else out that doesn't matter, you've got plenty of time for that stuff. But unfortunately, that's sometimes we have to have that conversation. Like, listen, if you want to be around to enjoy your family, or you just retired, right, and you want to enjoy for the next 10 years, you've got to change. Otherwise, you're not. And so sometimes, again, like Lori said, finding that why to motivate people is huge, and getting them to see the big picture of really what their health status really is, at the current point in time, and where it's going if they don't make a change. And unfortunately, we're seeing that all the time. I mean, these things that are chronic, absolutely preventable diseases, we're seeing going through the roof. And it's diet, it's lifestyle, it's the culture, it's the food. The foods we eat are just terrible for the most part. I mean, really, the foods we eat are just terrible, right? They're chemical laden. I mean, genetically modified foods are everywhere, right? And so, those are all things our body have no idea what to do with. When you're eating something that's not really of this earth, that it was man-made, synthetic, it's going to have impact in your body and how you digest, how you incorporate that into cellular structures. All of these things play importance. That's why we really stress whole foods for people. Getting away from boxed food, fixing your own food, eating out as little as possible, prepping your own food, because that way at least you know what you're eating, right? And you can have some control. You've got to take control of your diet to take control of your health. Those two are absolutely synonymous. You can't take control of your health without taking control of your diet. It just doesn't happen. And that can be the amount of calories that you eat, the types of foods you eat, where those foods are sourced from. But again, you've got to be absolutely responsible and take charge of your own health now. And we've got to figure out a way to get people to be motivated to do that. And that's the hard part sometimes.
We need a bit of a revolution, don't we, in the
Yes.
in the health
Absolutely.
yeah.